I'm Mike Samuel. I'm a hematologist oncologist here at Weill Cornell Medicine. I took a rather scenic route to medicine. I did other things. I was a treatment counselor. I lived in Oregon. I moved to China. I was an English teacher. But eventually I realized that I wanted to be a doctor, that I wanted to do medicine. I joined the group as a data manager or research assistant, which means I worked on the clinical trials. And in 2002, when I started, that was just about the time that Gleevec or imatinib was approved. And that was really the first medicine that was an oral medicine, a targeted medicine, that really changed the way we look at oncology and really started a whole revolution in cancer care. Weill Cornell Medicine is special because it's a top-tier medical institution, not only in cancer care, but in all of the subspecialties. And so we have every resource to call upon for the treatment of our patients. There's so much variety in what we treat, and the options for treatment are so varied, ranging from the standard of care, which may be the best available therapy, or clinical trials, ways to improve on the standard of care, or clinical trials when the best available therapy is not good enough. And we have all of that here. Cancer care and therapy is not just about finding the right pill or the right chemotherapy, but it's really taking care of all of the things that are incorporated into that type of treatment, and comorbidities and other health problems, and having all of those resources available is really essential to taking patients through the course of treatment. The role of a doctor really is as a teacher for a patient who's facing their illness or the burdens of therapy. This is what I know well, but at the same time, patients need to sign on, and they need to accept that, or they need to believe that and feel that you have their best interests in mind. Personalized medicine or precision medicine are these buzzwords that we use, and that has to do with all these mutations that we're now targeting and this exciting therapy. But to me, personalized medicine also needs to encompass who is the patient, and what is their commute, and who's coming to their visits, and what's the next wedding they need to go to, and what are the burdens of the treatments or the trials we're trying to put them through. And if you don't take that into account, then it's not really personalized medicine.